You're traveling to another country to have a surgical procedure and you're flying back home after. What are the problems you can run into? I'm Dr. Willoughby. I'm a plastic surgeon, and I've seen many a patient with problems from cosmetic surgery tourism. A big problem, there's a couple of big problems. The biggest is a lot of the more serious complications of surgery actually don't happen in the first few days after surgery. It's after 5 days after surgery and longer when you come back home, that's when the wounds are going to come apart. That's when you're going to get a fluid collection and you don't have someone to help you. That's when you could get an infection and there's no one, you don't have any continuity of care for someone to take over your care. In Canada, in our publicly funded healthcare system, our system will come in and help you if you have a life-threatening problem. But the issue is if you don't have a life-threatening problem, you're going to find it very hard to find someone who is willing and able to take over your care. Most surgeons they don't have an obligation to you because they haven't performed your surgery. You don't have that relationship. If I have a patient with a complication, I'm going to look after them. But if my patient is way far away, there's no way to help them. So you're stuck. You don't have anyone to help you. So you end up in the emergency department and you're going to find it difficult to have someone take over. And it's the period of travel back. Again, most wounds, if there's a wound problem or if there's infection, it's going to happen over 5 days after surgery. You're not going to have someone to help you, and you're going to be stuck finding someone to take over your care. So I personally am not a fan of overseas travel to have surgery because of those reasons, and it puts you in a tough situation. So never travel far from your surgeon, especially within the first 6 weeks after surgery.